classification of anemia on the basis of size of the RBC. As we have already seen in images, on the basis of size of the RBC, three things can happen. Either the RBC is smaller in size, that is microcytic. Microcytic means small size. Hypochromic. Microcytic, hypochromic RBCs. Hypochromic means central pallor is more than 1/3. We have already seen that in the image also. So first is MCHC, microcytic, hypochromic. Next is NCNC, that is normocytic. Next is normocytic, normochromic RBCs. NCNC, normocytic, normochromic. And lastly are the macrocytic RBCs. So three things can happen. Either the RBC will be smaller in size, or it will be same, normocytic, normochromic, or macrocytic. Starting with the first one, that is MCHC, microcytic hypochromic RBCs. We have already seen hypochromia means central pallor is more than 1/3. Hypochromia means central pallor is more than 1/3. The hemoglobin is pushed to the periphery. Everywhere there is pallor only. First point, most common cause of MCHC being iron deficiency anemia. Most common cause of microcytic hypochromic anemia. Most common cause of MCHC is iron deficiency anemia. Followed by other causes are thalassemia. Sideroblastic anemia. Thalassemia, sideroblastic anemia, and ACD, that is anemia of chronic disease. ACD, anemia of chronic disease. So causes of MCHC, causes of microcytic hypochromic anemia. Some people remember it as SITA also. This is SITA, SITA. Personally, I dislike it because you always have to go from most common to least common. Most common causes, iron deficiency anemia. Everybody knows this. Most common cause of microcytic hypochromic anemia, iron deficiency anemia. Followed by thalassemia, sideroblastic anemia, and anemia of chronic disease, MCHC. Next point, they tell me this. Overall, the most common cause of anemia is iron deficiency anemia. Female of any age group, 16 years, 26, 36, 46, 56, any age group, female presenting to you with anemia. Most probable causes, iron deficiency anemia. Next question. Most common cause of anemia in hospitalized patients. Most common cause of anemia. Most common anemia in hospitalized patients. Answer bache. Can I now safely say your options are iron deficiency anemia, thalassemia, aplastic anemia, या anemia of chronic disease? You know that overall most common cause of anemia is iron deficiency anemia, but we do not hospitalize IDA. We ask the patient to take the tablet at home. Most common cause of anemia in hospitalized patients is ACD, anemia of chronic disease. We hospitalize chronic disease patients. Next point. Most common type of anemia in ACD. Most common type of anemia in ACD. Anemia of chronic disease. Most commonly it causes which type of anemia? Microcytic hypochromic, normocytic normochromic, or macrocytic? Most common type of anemia in ACD, normocytic normochromic. NCNC, normocytic normochromic. It rarely causes MCHC. This is rare. It rarely causes MCHC, but it can cause MCHC. So it is in the differential diagnosis list of MCHC. But most common cause of anemia in most common type of anemia in ACD, normocytic normochromic. Next is normocytic normochromic anemia, which can occur because of chronic kidney disease, blood loss, aplastic anemia, PNH. Not concerned. Therefore, not important. We can divide normocytic normochromic anemia on the basis of retic count. On the basis of retic count, we can divide normocytic normochromic anemia into low versus high retic count. You already know this. You know the causes. Low retic count. Low retic count is seen in chronic kidney disease, aplastic anemia, myelofibrosis, ACD, anemia of chronic disease, ACD. All of these are normocytic normochromic. ACD rarely can cause MCHC also, but most commonly it is normocytic normochromic versus high retic count. With normocytic normochromic anemia, that is seen in PNH, blood loss, blood loss. There is acute blood loss. Patient was as such a case of he was normal. He was not anemic prior to blood loss. Blood loss causes anemia. Which one? Normocytic normochromic. Not important. What is next important for us are macrocytic anemias. We can classify macrocytic anemia into two types. That is megaloblastic anemia. We can classify macrocytic into two categories: megaloblastic versus non-megaloblastic anemia. Megaloblastic versus non-megaloblastic anemia. You very well know that megaloblastic anemia, it is associated with folic acid and vitamin B12 deficiency. Folic acid and B12 deficiency, megaloblastic anemia, versus non-megaloblastic anemia, which is associated with liver diseases, versus non-megaloblastic, which is associated with liver diseases. So this is the classification of anemia on the basis of size: microcytic hypochromic, normocytic normochromic, and macrocytic.